This EEG is of a 24-year-old woman with a history of seizures on multiple medications who has had a recent alteration in mental status. Now, first I'm going to change the montage to left over right. And to orient ourselves, we have left over right parasagittal, left over right temporal with the midline here. And the first thing we want to do is count our posterior dominant rhythm. And if we look at this and count, we see we have 1, 2, 3, 4, 5, 6, 7, about 8 hertz. And in a 24-year-old, that is a slow background. If we want to call this normal, her background should be 8.5 hertz at a minimum. There also are some slower waves in here. These are about 5 hertz, these waves here. And so this is mostly theta frequency activity. It does look symmetric from hemisphere to hemisphere, and it's symmetric in terms of frequency and amplitude. If we look at the frequency amplitude gradient here, it's not very well formed. We don't see that gradient in terms of frequencies which decrease going to the back of the head and amplitudes which increase. And overall, this picture may be of drowsiness. We can see the same picture of diffuse theta with a poorly formed frequency amplitude gradient when patients are drowsy. So we're just going to have to keep moving forward in the study to see what happens if this goes away and her background becomes more normal. Now, here she's opening her eyes. We see attenuation of the background, so this is reactive. And as we keep going here, we see her eyes are blinking, and again, her eyes are closed. Still a lot of slow waves. There is an area here where it looks like her background does speed up, probably to around 10 hertz there. It looks like it's normal frequency there briefly. And now she's hyperventilating. Again, this just looks like diffuse theta. Maybe a little bit of buildup of slow waves here. We see more slower waves, higher amplitude. So a very mild buildup to hyperventilation. Nothing very remarkable here. As we proceed forward, we just see a lot of diffuse theta. So now hyperventilation is over. And the background still looks slow. It just looks like diffuse theta activity here. And this is not normal for a 24-year-old. We should see faster frequency activity than this as her predominant background activity. We did see that brief area of 10 hertz activity, but that was only for about 1 second. The rest of this has just been diffuse theta. Here we can see some drowsiness here. The eyes are going back and forth, horizontal eye movements, and here's some drowsiness here, attenuation of the background, and then this is her waking up here. That's her wake background, as I've said, quite slow. And as we continue, we're going to look for other elements of sleep, such as other elements of stage N1 sleep, such as vertex waves, and of stage N2 sleep, sleep spindles and K complexes. So I'm backing up a page here. She's waking up, so that's her awake background. And as I page forward, we can see this point here where she goes from wakefulness to drowsiness. Here she's drowsy. We see that diffuse background attenuation. And there's a little bit of artifact here, there at T3. That looks like EMG artifact right there. Okay, so she is drowsy. We did not see any vertex waves there. She's moving around a bit. And again, just drowsy and waking up. We have not seen any sleep activity yet. And we can see here there's some more muscle artifact here. This is a very characteristic looking muscle artifact. It's very sharp, it's almost needle-like, and we don't see a field. So if this were a spike, the amplitude is quite high. You would expect to see a field, meaning you would see it in neighboring electrodes as well. We just see this tiny little divot here, which is quite insignificant. This also has a very characteristic appearance of artifact. It's very sharp and it goes down like this. That's a very characteristic morphology of artifact. So that's muscle artifact there. All right, and keep going here, and more artifact on that page. So just drowsy here. Here's a vertex wave, the first one we've really seen. This is probably a poorly formed vertex wave, and here's one here. Not very well formed, but we do see the sharp wave phase reversing at the vertex. And as we continue on, we'll look for stage N2 sleep. So far we have not seen any sleep spindles or K complexes. So she's only been drowsy. We have not seen any epileptiform activity. We haven't seen any focal asymmetry. And I'm going to back up and just look at this because that does stand out a little bit. This is likely just background activity here. She's waking up a little bit, moving around. That's not an epileptiform discharge there. It does catch your eye because it looks somewhat sharp with a slow wave after it in the bifrontal regions. And if we change the montage here and look at it in an average, we see this activity. We see it in more than one electrode here, and it's similar to other waves that we see in that region, so that's likely just the background activity, a little bit higher amplitude there. The morphology does not look forbidding like you would see with an epileptiform discharge. Okay, so here she's waking up, her eyes open, and again the background is slow. So the overall conclusion of this study is this is an abnormal EEG. It's a mildly abnormal EEG due to mild diffuse background slowing and disorganization. This type of slowing is nonspecific, and it can be seen in a variety of conditions. The most common is encephalopathy of very nonspecific etiology. It could be a metabolic encephalopathy, it could be toxic, and we can also see this secondary to medication. Some anti-epileptic medications can cause background slowing, and some psychiatric medications can cause background slowing. A lot of people in their reports for this will just say, this is an abnormal finding that is nonspecific and consistent with diffuse neuronal dysfunction. It's very generic, but that does it does explain that this finding can be secondary to a whole host of different etiologies. And it's always important, as usual, to mention that no epileptiform abnormalities were seen during this recording.